Right, it's 11 o'clock, so are we good to go? Good. So can I start the February meeting of the CQC board? We have an apology for absence from Stephen Marston, had a prior commitment before he joined the board. Otherwise, there are no apologies that I'm aware of. Everybody's here. Are there any declarations of interest anybody needs to make? Thank you very much indeed. We're going to be joined by Latoya Tabazevra from our Race Equality Network. She's just finishing another meeting. She'll be joining us shortly. She will be very welcome when she gets here. Just want to say that some months ago we were asked if it was possible to move to a live streaming of this board meeting as well as recording it. We've now sorted the technology out to be able to do that, so I hope that people are pleased and will be tuning in at 11 o'clock every board meeting going forward. There's the minutes of our meeting of the 20th of January. Are they a true and accurate record of everything we discussed?
Yes.
Thank you. We'll take those as approved. And amazingly, there's no outstanding actions on the action log. Is there anything arising anybody needed to raise that's not otherwise on the agenda?
No, thank you, Peter.
Okay, good. Thank you. So, Ian, can I come straight to you, please, and the executive team report?
Thank you, Peter, and good morning, everybody. I think at the last meeting, I talked about our organisational priorities for the first quarter of the calendar year 2021, and at that point, I think we were talking about our priorities set against a backdrop of significant pressure against COVID. I think it's fair to say that that level of COVID pressure continues, but I think there are definite signs of positivity, and in no small part, I think, due to the incredible and continued efforts of everybody that works within and around and volunteers in the health and social care system. So, I know all board members would want to join me in our thanks for the incredible stories that our inspectors see day in, day out in the field. I think when we spoke last month, I was making the point that we were using our regulatory activity primarily focused on creating capacity in the system, and we did that by doing inspections, which in some cases upgraded ratings, which meant that local authorities in particular were able to buy additional care from providers who traditionally hadn't been seen as performing well enough. By going back and looking again at those providers and seeing their improvement, we were able to create new capacity. We were also doing work which was responding to risk, and I talked about last month about how we were responding to risk. And I also talked about the notion of us supporting the wider system, so spending time with colleagues at the Department of Health and Social Care, NHS England and elsewhere, talking about policies and guidance and giving a perspective from CQC on contributing to the development of that sort of thing. So I think I just wanted to pick out some headlines in terms of what that translates to in real terms on the ground. We've reviewed about 20% now, just a little over 20% of residential homes in social care, particularly with a focus on infection prevention and control, and that gives the public assurance around those particular locations. There are now 155, I think that number may even be 156 designated settings. These are settings which you'll recall are locations which have been designed for people who are coming out of hospital who are otherwise medically fit to be discharged, but are still testing COVID positive, and they themselves are asymptomatic. So it's a unique group of people, but what government wanted to do was create an environment that was safe and caring for those group of people who couldn't go home, but equally didn't need to be in a hospital either. We've increased the number of designated settings by 27 in the last 6 weeks. So again, a huge tribute to Kate and her teams who've been at this, working incredibly hard, along with colleagues from other parts of the organisation who are supporting that activity. There are 20 providers in adult social care have had their ratings uplifted, and of course that translates, as I said earlier on, into additional capacity in the system. It enables local authorities to start to commission services from organisations that perhaps had too low a rating before. And in primary medical services and in hospitals, both of those teams have been focusing their efforts on looking at high risk services. Those services, by virtue of their regulatory history, or because we've had new information from members of the public or from whistleblowers that give us cause for concern. That's been the complete focus in hospitals and primary medical services. So I think what drops from that is we haven't been doing routine inspections as we talked about last month, and that continues to be our position. And so I think the priorities we set last month feel like the right priorities, and we'll continue to operate in this mode for the foreseeable future. I think we are mindful of the Prime Minister's announcements earlier in the week, and we'll be looking at those in the context of what we'll be doing during the second quarter of this year, and indeed for the rest of this calendar year. And we'll be coming back to the board and talking more publicly about our priorities for the rest of the year over the coming months. The second thing I just wanted to touch on was the Health and Care Bill. We've been working with colleagues at the Department of Health and Social Care on the development of the bill and the development of the white paper. We've set up an internal project team to make sure that we can contribute to the development of the detail, particularly around assurance around assurance of systems. We were very pleased to see the creation of ICSs in the white paper, and we were pleased to see the remarks about needing to have assurance around the performance of those ICSs, and we're keen to develop that in a constructive way with the department and of course NHS England. We're doing similar work around local authority assurance. Kate and her team are working with the department and other groups such as ADAS and the Local Government Association on what the bill may talk about in terms of assurance around local authorities as well. So I just wanted to say that I think we see the white paper as positive. We see the Health and Care Bill as a positive development, and we're working closely with colleagues on the next steps and making sure that the detail, when it comes, when the bill itself actually starts going through committee stages later in the spring, then we'll have been part of that development process. So I'm going to pause there, Peter, for any questions for me before handing on to Kate.
Thanks, Ian. I must say that the conversations I've had with providers have been very welcoming of our intended role around systems. They were very concerned that if we didn't have that, then we were going to be out of step with where they were going. So it's very positive. Okay, no questions. Let's move on then. Kate, to you.
Okay, thank you, Peter. So as Ian said, we've committed to do over 600 inspections a month with a strong focus on infection prevention control. In February to date, we've undertaken 698, so we're exceeding our target as we did in December and January, which is positive. Our work on designation settings, so that the number continues to go up, and the number of designation settings is equating now to 2,169 beds. So a big thank you to all of our teams who are out there inspecting these services. When it comes to infection prevention control, generally we are finding that providers are doing a really good job. There are two main areas that we really need providers to continue focusing on with the same level of vigilance, which is about continuing to ensure good use of PPE and effective use of PPE. And then the other area we sometimes see providers fall down on is about the need to have up-to-date risk assessments in place and to ensure that their IPC policies are really effective. So those are a couple of issues we pick up when we have concerns around IPC. And where those concerns arrive, we are swift to take action. And there's a spectrum of actions that we can take depending on the severity of what we find, from issuing a warning notice through to changing a provider's registration. But just want to emphasise that it's a very small number of occasions where we need to take such action, because generally providers are out there doing a really good job when it comes to infection prevention and control. Just going to move on and briefly mention closed cultures. It's a shorter update this month because we focused on this very heavily at previous boards, but just to reassure a board that work is continuing. There's been a focus in February about developing the way we need to regulate services where we're concerned that a closed culture may be developing. So whether we call it an intensive inspection, we need to clarify the description of it, but the focus is about how do we really immerse ourselves in these services? How do we really understand what it feels like for someone who is receiving care in, for example, an inpatient unit following a crisis in the community? And we will be piloting our new approach through March. I look forward to giving board an update in March and April on that activity. And then finally, for me, market oversight. So board will be aware market oversight was established back in 2015. At that point, guidance was developed to enable the team to function and for there to be clarity about their role and remit. We're over 5 years on now, and there's been a huge amount of learning in the way that market oversight works with providers and with local authorities. And we are here today with a refreshed guidance for board to sign off. This has been following consultation with providers between August and October of 2020. Really want to thank those providers who have engaged with us, but also really helpful feedback from local government about the importance of them having sufficient notification where we have concerns about continuity of care, because ultimately it is directors of social services, it's local authorities who hold the safeguarding net to ensure that people get their care delivered safely. So just want to flag to board the revised proposed guidance is available to you, and if board is happy to support the proposed changes, we will publish that on our website following board meeting today, and that will be effective kind of immediately. So that's all from me. Thanks, Peter.
Thanks, Kate. It might be a good moment just to also thank Stuart Dean and the market oversight team for the work that they do, because it really is quite important but pretty difficult. So I just think the board would like to thank them. Any questions for Kate? Or fine, Kate, your lucky day. Let's move on. Ted.
Thank you, Peter. Ian has already referred to the situation in hospitals, but just to remind the board, hospital services over the last few weeks have been under exceptional pressure. The number of patients with COVID in hospitals is now beginning to fall, but it is still at a very high level, including patients in intensive care on ventilators. So the pressure continues in hospitals. It is beginning to diminish, but I think will continue for a while longer. From our perspective, we're continuing our risk-based approach, which I described last time and which is outlined in the board report. During this time, we've intensified our monitoring of services, all services, using a variety of means, but particularly the Transitional monitoring app, the tool we've developed for this to gain intelligence around areas, particularly independent healthcare and the new vaccination centres. But we are monitoring the intelligence coming in on all services across the board. Where necessary and where we identify risk, we are taking action. And that is often working with other parts of the system, such as NHS England, to make sure services get the appropriate support they need to deal with the pressures they're under. So wherever possible, we're taking a supportive stance. But where necessary and where we identify a risk that we are concerned is not being addressed, we are undertaking a few risk-based inspections, and they've continued throughout this period. But we've always been very mindful about not adding additional pressure on services already under pressure. And indeed, in many cases, these inspections have been because staff have raised with us concerns and have asked us to take action and get involved. And I think frontline staff often welcome our presence where they have particular concerns about quality of care. And in those cases, we will produce reports and take action as necessary. We've also started to work with providers and with NHS England about how they are going to manage the backlog of care that has built up during the pandemic. Delays in treatments for patients is a great concern for services themselves, and frontline staff are very concerned about their ability to catch up with some of this backlog. But they are developing, I'm glad to say, detailed plans at system level with different providers working together in a very joined up way, which I very much welcome. And we're learning from how they're doing it, and we'll build our understanding of their management of the backlog into our assessments of services going forward. One of the most important lessons from the pandemic is the importance of supporting and listening to the workforce. I think we've learnt that a great deal in terms of the feedback we've had, and I publicly praised the workforce for speaking up about concerns and raising them with their providers and with us. And at the height of this wave of the pandemic, it is clear that in many of the services it's been badly affected, such as intensive care, medical services, emergency medicine, ambulance services. The staff have been very deeply affected by the situation they found themselves in and the care they've had to provide in very difficult circumstances. And it is vital that going forward the staff are given the chance for some respite and in the immediate future. But we also need to make sure that as we go forward in the longer term, we value and support them better than perhaps we have done in the past. And this is going to be very central to our assessment of services going forward and to our well-led reviews. And I think the services have learned that, and we need to make sure that those lessons are learnt going forward. Just one final point for me. I'd just like to pay particular tribute to the staff within the Hospitals Directorate who've been going out inspecting services under difficult circumstances. They have been praised often by the services they've been inspected for their supportive stance. And I know, as I've said already, that staff often welcome them onto site. I am convinced that our regulatory activity is having a big impact on the quality of care and is helping services cope with the pandemic. And I think it's really important we recognise the contribution of our staff, as well as, of course, all the frontline staff in clinical services who've been working so hard over the last few months.
Thank you, Ted. Ted, can I very much support what you were just saying? I mean, having a recovery plan for the backlog is really important, but having a recovery plan for the staff is an integral part of that. I mean, people are exhausted emotionally and physically, and not only do they, as human beings, deserve to be able to recover, but from our point of view, when people are exhausted, that's when accidents happen. So from a safety point of view, it's really important there is the recovery for staff, as well as then a recovery plan for the backlog. And I just worry that there will be a public or political expectation of things happening to get waiting lists down and so on more immediately than is feasible. So I think we just need to have an eye on that. Otherwise, as I say, accidents will happen.
I totally agree with that, Peter. I think it is important we do remain a strong voice for patients who need care, and I'm determined we will do that. But I think we're serving their best interests if we support staff as well, and I think we can combine the two. And we need to have both priorities in our minds: supporting staff, helping them recover from the pressures they've been under, but equally supporting patients to get the care they need.
Yeah, for sure. I 100% agree. Robert.
Thank you. Well, my question is about staffing, and I too like to join in the tribute to the staff who are working sometimes under quite almost impossible conditions. And it's really about that I want to ask in relation to our approach to the standard of care provided and the safety of care, which of course is a priority. The reality, as I understand it in some places, particularly some CCUs in recent times, has been that the staffing levels have not been possible, the normal staffing levels have not been possible, and indeed the normal qualifications required of staff providing care have not been possible either. And the most extraordinary efforts are made in some places, sometimes I hear, with consultants taking the place of nurses at bedsides, doubling up and so on. Bearing in mind all that and the difficulties, are we saying we require the same standard of care, the same safety levels as always, or are we, and therefore something needs to be done, or are we saying we recognise that in these extraordinary times that can't necessarily be done and we're doing the best we can? And how do we make those decisions when we get expressions of concern or whatever. I appreciate that's a difficult question to answer holistically, but it is a potential concern, I would suggest, going forward as to whether the standard of care patients would probably think they're entitled to are actually being provided in places where some of these extraordinary things are happening.
I think that's an important challenge, Robert. What we have said very clearly is we expect services to give the safest possible care they can within the resources available to them. And I think we all recognise that services have been enormously stretched in resources terms, and most importantly in terms of staffing. I think some of the staffing flexibility we've seen in response to the pandemic has been really very innovative, and I wouldn't necessarily always cite it as a diminution in standards, but equally we have recognised, and we did work with NHS England and providers to establish new standards around their staffing in intensive care, etc., where the normal one-to-one approach could not be maintained just because of the enormous expansion in intensive care patients going forward. So I think it's a very balanced view. I think there's some real positives come out of this in terms of using staff in a flexible way. I think it's something we want to carry forward, because the service is under pressure every winter, but we're getting later on in the agenda to talk about winter pressures. And actually some of that flexibility we've seen in response to COVID would be very welcome in the normal settings of winter pressures and other times where services are facing increased workload. So I think it's a very balanced response, but equally we've asked of services that they maintain the safest possible care within the resources, taking into account the pressures and taking into account the needs of all patients.
Could I just follow that up very briefly and say that even where that is right, and I absolutely accept that one would hope it is right in almost all, if not all places, it may not necessarily feel like that to the staff in those situations, because they are doing things in a new way they've never done before. They're being told it's different and so on. And the stress and strain in relation to a staff feeling perhaps isolated in that way, and perhaps feeling, indeed, the CQ inspector might be, or some other regulator might be coming calling, is part of the stress from which they are going to need to recover. And I do hope we're able somehow to mitigate that, so staff can be reassured in these circumstances they are doing what we recognise as their best.
I think what we've seen in terms of staff contribution has been tremendous, and I think we're all very impressed by the work the staff have been doing. As I say, often flexibly. You talked about the surgeon being the assistant on the intensive care, which I've heard of, in many places. That's not a unique happening. It's been very wide, where staff have actually been taking on roles they wouldn't normally take on. I think one of the things that has been really encouraging during the pandemic has been that staff have been willing to speak up about their concerns. And I think that reflects the flexibility they're being asked. And if they feel that they're being asked to do things that are not providing the safest care under the circumstances, then it is only right they should raise those concerns. We want them to raise them within the organisation so they can be tackled immediately, but equally we welcome it if they raise them with us at the CQC. And as I said earlier on, if we identify risks, we will try and make sure that support is given so services can address those risks that staff are raising. Occasionally we'll go in and inspect, but we're not going to inspect to add pressure on staff who are already overstretched. We're going in to inspect to support them in raising the concerns they've raised with us. So I think that's really important. When staff raise concerns, it's important they are taken seriously. It's important they're listened to and their concerns are taken seriously and acted on. And that is what we're trying to help and support staff under difficult circumstances.
Thank you. I'm sure to hear that.
Thank you, Ted. Anything else for Ted? Great, thanks, Ted. Rosie, I think we'll come to you now, please.
Thank you very much, Peter. So just a couple of things to mention from me. Firstly, general practice is as well under huge demand, like many other parts of the system. But I just wanted to take this opportunity to send my congratulations and thanks to primary care colleagues who I think have pulled out all the stops with the vaccination programme and have been doing a tremendous job on top of already a very busy workload and a huge demand. And I think what's been happening with the vaccination programme has been hugely impressive. So that was the first thing I just wanted to mention. What Ted's been talking about backlogs affects the whole system, so that has a huge impact on primary care, as well as people are waiting for treatment, and that is also having an impact on demand in primary care. And so we do need to see a whole system approach to the system recovery and backlogs, and make sure that all parts of that pathway are very joined up. As a result of the huge demand, we continue to take a risk-based approach in all of the sectors in PMS, and we are following up concerns and acting accordingly as required. Just to move on to the items in the report highlights two areas. The first is around the work we've just started recently in safe houses. I'm pleased to say that programme is now up and running and going very well. As the report says, this is the first time anywhere in the world we believe that safe houses have had this scrutiny, so we're very pleased to be undertaking that work. The second area I just want to mention is the provider collaboration reviews. As the board is aware, we've undertaken 2 rounds already of the provider collaboration reviews, one that's been looking at the care, the interface between health and social care, that was published last autumn. We've then undertaken the round with urgent and emergency care. We've published a report around the interim findings of that. I've got a letter going to CCGs this week to highlight some of those really good examples that we've picked up, because I think there's a real opportunity for CCGs to be considering, and systems to be considering, these innovations that we've seen across the country and learning from them and seeing what will work in those areas and what they can do to prepare themselves for future demands on their services. So that is going out, and we're looking at publishing the final urgent emergency care report in the spring. We did pause the work we'd planned on cancer due to the pressures in the system. We're now working through how we can continue the work, the field work of the cancer, the mental health and the learning disabilities provider collaboration review. These are all areas we know that have had significant impact due to the pandemic, and we want to be able to pick up the learning and share that widely and work with those local systems. So that is very much the next stage, and we've done a lot of preparation in the background, so we're in a really good position to be able to roll those out as soon as we feel it's appropriate with the local systems. Thank you, Peter.
Thank you, Rosie. Rosie, did you not want to say anything about the thematic review or not?
Oh, sorry, Peter, I've missed that. We were talking about it earlier. So the DNA CPR review, the Do Not Attempt Cardiopulmonary Resuscitation review. I'm pleased to say we have now undertaken all of the field work for that review. As the board is aware, we published the interim report in November, which hopefully everyone's had a chance to read. We are planning to publish the final report in March, and we'll be looking forward to sharing our findings at that stage.
Fine. Thank you very much, Rosie. Thank you. So let's move on, if nobody's got any comments or questions for Rosie, to Kirsty. Kirsty.
Thank you, Peter. So just a couple of updates from me in this section. Our vaccine programme, Rosie's already mentioned the amazing work that's been going on there, but our inspection teams, the hospital teams have started to monitor the trust vaccination centres this month, and GP-led vaccinations are being monitored through our normal routine activity. We are collating data, and we will anticipate that we will be putting out some intelligence reports on that over the coming months as we do more work in this space. In terms of just one other thing for me, our annual reports and accounts. So I'm pleased to announce that we finally managed to get the report and accounts laid before Parliament on the 11th of February. These have been delayed significantly. We would normally have expected to do that back in the summer, but we were waiting on the NAO to finalise some audit bits on their behalf in terms of local government pension schemes. That's now been done, so pleased to account those have all been laid and are okay. So that's good news. That was all for me. Thank you.
Thank you, Sally. Did you want to come in?
I was just going to make the point about local government pension schemes and the fact that the delay isn't due to COVID, it's actually due to audit of those pension schemes, and that's an issue that isn't just for CQC, it's actually for many organisations across the public sector. So I wouldn't want people to think that we'd had a different delay to many others. Thanks.
Thank you, Sally. Any questions for Kirsty? Gosh, we're doing well. Famous last words. Mark, is it your normal nil report on cybersecurity? He said, hopefully.
I'm very pleased to report nil report. Yes, absolutely, Peter.
Marvellous. Good. Chris, strategy.
Great. Just 2 bits of update on the strategy. First of all, we've been supplementing our usual conversations with stakeholders with a particular focus on building engagement with seldom heard groups and key stakeholders. We've already had close to 300 formal responses, but we know there's many more due to come in. There's been really strong support for our 4 themes in the strategy, in particular around the people and communities, strong support for the idea of building a robust mechanism for collecting and sharing information from patients, carers, their families, and to make sure we can build that monitoring alongside the data information we collect from other sources. In terms of smarter regulation, particularly strong support for the idea of linking data and information to site visits to have a sort of a better and always on view of quality. Safety through learning, a really strong emphasis, particularly from providers, on how we provide support for learning from within organisations, potentially systems, and also nationally. And in terms of accelerated improvement, building the right coalitions in the right sectors. Some sectors have different support mechanisms for driving change and improvement. The responses have indicated that they want to make sure that people, CQC recognises those and works with those different groups to support change and improvement, but a really strong support for the themes of the strategy so far. Shall I go on? Sorry.
Yeah, I was only going to say, I mean, certainly the informal feedback I've had on the strategy has been very positive, Chris.
Yeah, I think I'm really pleased about the levels of engagement. And the useful challenge where we've got a sense of the detail, a sense of direction we might want to take. So I'm really pleased.
Yeah. Mark Saxton, you wanted to come in.
Thank you, Chairman. I just wanted to congratulate Chris on the way that we're using social media to reach out to people and using social media to get the information back in. I really think it's best in class that you're doing, Chris. So well done.
Thank you. I'll pass it back to the team. Thank you.
Good. Thanks, Mark. Okay, Chris, do you want to move on?
Yes, so just some quick updates on some of our work in Parliament recently. We had a meeting with Alex Norris, who's the Shadow Minister for Public Health and Patient Safety, particularly in relation to maternity services. What was really good about the meeting was a particular focus on Nottingham University hospitals, but we representatives from CQC met with the Regional Chief Nurse and a Regional Medical Director for NHS England and Improvement. I think the importance of that is it gives a sense of the system working together to support change in an area. I think that's going to be really important, particularly as we come out of a COVID crisis, that we can demonstrate that the work that we do is translated into the work that NHSEI and others will do to support local systems and local services to change. So I think it was a good meeting, but I think it's a really important signal that we send about how we work with other partners to support change. We've also written to the Health and Social Care Select Committee to offer a further update on our progress on the Closed Cultures programme that Kate mentioned earlier. And there's also been a strong support for our position regarding the regulation of LD and autism services from government and Parliament. And there's a letter, the conversation that we've had with the Health and Social Care Committee following their session on the treatment of autistic people and individuals with learning disabilities, I think has given us a clear statement about what our intent is and also what we expect from others and the partnerships that we want to strike. Lastly, just to give you a sense of where we are in terms of our support for the bill, there's a team of people working from across the organisation on the bill just to make sure that both our formal response and also the way in which we'll work with the DHSE will ensure that we can deliver part of our strategic ambition in the strategy through the bill as it develops over the coming weeks and months. Happy to take any questions.
Thank you very much, Chris. Any questions for Chris? Goodness me, we're doing well today. Right, so immaculately on time. Sorry, nothing else, is there, Ian, from the executive team?
No, thanks very much, Peter.
Perfect. So, as I say, exactly on time. We'll move on to the quarterly performance and finance report. I'm not sure, Kirsty, whether you or Chris are starting.
Chris is going to kick this one off.
Yeah,
Fine.
I'll run through. Thanks, Peter. So yes, this is our performance report at the end of Q3. We've tried to include some additional performance indicators in relation to our priorities between January and March, just for a bit more of an up-to-date performance position. I'll run through some highlight areas and then invite discussion and questions from board. So in terms of delivering an effective and efficient registration service, this is slides 4 to 5 in the report. During the pandemic, we've aimed to prioritise registration applications that help support the system's response to COVID. We wrote to providers with applications in progress in the middle of January to alert them to possible delays to ensure being open and transparent. We continue to monitor the impact of these decisions and aim to minimise any delays. This has included redistributing internal resource to help manage our response. In terms of our actual business plan performance, Q3 shows we're taking on average just under 114 days to process complex applications, which are the smaller in volume, and 19.8 days for simple applications, which are of greater volume. In terms of we use our intelligence to regulate registered services, which is slides 6 to 10. 97% of safeguarding alerts have been processed within 1 day against a target of 95%. And for safeguarding concerns, that's where other key stakeholders are already involved. We aim to record our action within 5 days. 94% are recording it in this timescale against their target of 95%. We've seen a gradual increase in the volume of whistleblowing inquiries that are received each month, with just over 11,000 received by the end of Q3. And then in January, that's recorded our highest volume received within an 18-month period and represented a 58% increase from January 2020. So safeguarding and whistleblowing information, it continues to be a key part of our intelligence to identify risk. As at 9th of February, 54% of inspections triggered by risk were in response to information of concern. And during Q3, we ceased to use our emergency support framework and expand our regulatory actions by implementing the Transitional Monitoring Application, the TMA. As at 9th of February, 46% of registered locations have had regulatory action from us during the year, be it ESF, TMA, or inspection, and that includes just over 5,000 inspections. As Kate mentioned, in ASC, we continue to undertake IPC inspections to support establishment of designated settings, designated sites, in the aim of freeing up capacity in the system. As at the 9th of February, 156 designated settings have been approved, equating to just over 2,000 beds. In terms of enforcement, where we use enforcement to keep people safe, where we decide to take urgent enforcement action, we aim to serve notice within 3 days in 70% of situations. At Q3, we're achieving this for 93% of situations. And lastly, for me, in terms of equipping our people and organisation to deliver on our purpose now and in the future, which is slides 13 to 14. In terms of turnover, that's tracking at 7.4% against 10% target. With turnover for those under 2 years service tracking slightly higher at 10.81%. Sickness year to date is 3.29% against a target of being under 5%. And on our budget, our revenue budget is forecast to be 11.9 million underspent at the end of the year. That includes potential 1.5 million shortfall on provider income, with capital is now forecast to be 0.3 million underspent, which allays concerns we previously had that could potentially be overspent for the year. So I'll pause there and open up for any questions or comments the board have. Thank you.
Thank you, Chris. Just on that last point, I sort of congratulate you and your executive colleagues for managing the budget and the financial performance extremely well in the circumstances. Sally.
Thanks, Peter, and thanks, Chris. Yes, I agree about performance. Given we will have an underspend and obviously the pressure on public finances, are we discussing with the department whether we'll be required to return that money or whether we'll be able to use it for obviously a huge level of transformation programme that we will have in 21-22?
So can I make a point, and Chris will want to comment as well, no doubt, maybe Ian as well. This is not the department's money, this is fees. So this is not money that could go back to the department, and it would be wrong if it did, because about half of it has come from independent providers. So it's a mixture of public and private money. So the money belongs to the CQC. And in previous board meetings, Sally, before you were on the board, we've had discussions that have made it fairly clear that, you know, over time, we're not a for-profit organisation. So over time, either any surplus in 1 year is used for future work that is important, or it goes back to providers through either a reduction of future fees or avoiding an increase that would otherwise have been there. So I think it's really important because, and I'm glad you raised it, because other people raise it from time to time, but it really is important. This is not the department's money, or it belongs to the CQC and ultimately to the providers who paid the fees. Chris, do you want to add anything? Do you want to add anything to that?
No, Peter, I think you've covered it off well.
Thank you.
I find that situation elsewhere, and I think that's really important to clarify, so thank you.
Yeah, no, it is important because you're not the first person to have asked it, Sally. Mark Saxton.
Thank you, Chairman. Chris, thanks for the performance report. Regulatory action response to risk. That chart there. I think that's telling me that we are accessing a whole range of data from different sources in order to make a response in terms of regulatory action. So, you know, I think that's what the chart tells me. And so as such, it really is a reinforcement of our strategy about being an intelligence-led organization, because we are already gathering from different sources, and as we go forward we will gather more and more and we'll be able to refine it more. I think that's what that chart's telling me. I hope that's the case.
It's precisely that, Mark. Yeah, absolutely. It's how we use the information that's coming into us and responding to risk appropriately. Yeah.
Thank you.
Thanks, Mark. Kate, you've got your hand up. Sorry.
So just wanted to use that as an opportunity also to plug our Give Feedback on Care. So when people do take the time to tell us about the quality of their care, be it good, bad or mixed, it absolutely does inform our inspection activity. So on that chart, Mark, it talks about 54% of our risk-based inspections being triggered by information that is given to us by people who use services, their families or staff. So just wanted to use this as another opportunity to say to people, keep on telling us about the quality of your care, because it absolutely informs and makes a difference to how we direct our efforts and our energies as well when it comes to inspection.
Thanks, Kate. Chris and then Jora, please. Chris Day.
Just to build on that, I would also to thank the partnerships that we have with organisations around feedback. Kate's exactly right. But Robert obviously is on the call. Healthwatch is a really strong partner in our work on Give Feedback on Care, as are a number of other organisations. And I think it's a testament to the partnership that we've been able to grow and still understand how services are operating outside. And we've seen not just the people who use services, but also, as Ted mentioned earlier, people in services providing that information and that feedback. And it is vital. If we are going to drive learning and we are going to drive improvement, which are key parts of the strategy, we need that feedback in order to make those important changes.
Thanks, Chris. Jora.
It's a general point, and I'm not going to put Chris on the spot. But as you look through the data, and it's very good data, very insightful, and having been on the board for a few years now, I think we're getting much more insights than we were previously. So congratulations to the team on being able to provide this level of of insight. But going forward, as we become more intelligence-driven or insights-led, do we see this sort of cause and effect sort of data coming together? So if we were seeing more whistleblowing or safeguarding or slower registrations, would that lead to, you know, some form of lack of service or a degradation of service? I'm just wondering, and I'm not sure who I'm directing the question to, but I'm just wondering, as we become sort of this holistic sort of intelligence-led organization, if we could sort of connect the dots and actually say, actually, we're seeing a trend here. But I haven't seen it sort of put in those terms as we become intelligence-led. I've seen like we're doing data collection and we're putting the data together in registration, but I haven't really seen from a strategic perspective if that's the direction we're going, or if I'm just reading it incorrectly and assuming that that's the direction we're going.
So you're getting lots of people going to answer your question, but let's start with the Chief Executive, Ian.
Thanks, Gerard. And I guess to answer your question specifically, ultimately, I'm the one who you should direct the question to. But I think that the serious point is, I think if you look at the investments we've made in technology over the last 18 months in particular, our ability now to bring together dashboards and data is in part reflected here, but actually on a day-to-day basis, we've been able to stand up dashboards, look at particular topics. So I think we're at that stage of producing dashboards, but part of the transforming our organisation process is to start to look at our intelligence and data handling capabilities more broadly. And I think we will be starting to look at multiple different data attributes, types of data. What is, if A plus B plus C equals, it comes together, what does that actually tell us? Both in terms of what's going on within providers, but also what's going on within our own organisation. So I think there's a skill set and a capability that we're building as part of the transformation programme over the next year or so, which will start to bring some of these things together in innovative ways. And I'm really keen that we see that we use sort of research and development. We've got a research and development committee, which is headed up by Rosie, that will start to look outside our organisation, outside our sector, and start to look for lessons and hypotheses from outside the sector that we can then use our own data to look at. And I think that the technical platforms we've built give us an ability to do that quite quickly now in a way that, 12, 18 months ago, we probably wouldn't have been able to do. So definitely it's the direction of travel. Thanks, Gerard. Thanks, Peter.
Thanks. Are you happy with that, Joy? You don't want to come back?
I guess, well, I'm happy with that, first of all. But I guess it would be sort of good to see it sort of written down. Hence, Ian, what I'm saying is I think this is, and listening to you, it sounds like we are going in that direction. But at the moment, it seems more of a process of, and you have to start somewhere by collecting your data, but I don't quite see the vision. And then we could say, these bits of work like the registration work and the sort of and some more of the insights work, I don't see what the end goal is, and maybe I've just missed a paper on it, but it would be good to see that and then sort of work backwards to see if we've missed anything. And also you talked about the capabilities within the organization. I know that sort of data-led sort of predictive analysis of, as we assess risk, is probably going to take skill sets that we may or may not have in the organization. And I'm not quite sure if we do or do not, but it would be good just to see that, even if we can't achieve it today and we're a year and a half away, it'd be good to see where the North Star is heading, and what roughly it would look like.
I think Kirsty wants to come in, but I suspect she's going to say some version of it's a piece of work within the target operating model that Helen Lowrens is currently leading on to do exactly as you've just described. And I think I was only speaking to Helen yesterday about this, around recognising there's a set of capabilities and capacity that we would want to have internally, and we would want to invest in people, both in terms of the intelligence group, but also more broadly, so that every single inspector is capable of understanding the data and information that's put in front of them. But I think more broadly is what are the third-party relationships that we want to build to keep us at the cutting edge of some of this, which at the moment we have some relationships, but we need to probably formalise those and have a structured sense of what we want to make and what we want to buy, which I think is, I guess, at the heart of your question. But Kirsty, I think you perhaps want to comment on that.
Oh, I think you probably said everything I was going to say, Ian. But I think just in terms of the timeline for this stuff, this is a sort of the key enabler, I suppose, for our strategy going forward, and it's the bit that we've prioritised around our transformation delivery plan. So the work that we're doing now on intelligence-driven insight and intelligence-driven enablers will build not just the tools, as Ian says, but also the people, capability and capacity to do this work. And there's also a cultural piece that needs to go with it too. And as Ian said, we all become data generators as well as data consumers within the organisation. And I think there's the big cultural piece around that in terms of how we collect data, how we store it and how we use it, recognising that it's not just a piece of paper that goes into the system, it's actually a piece of intelligence that we will use and use again going forward. So I think we'll happily, I think we're going to bring this to, I think the business case for IDEO is coming to a subcommittee not too far away, so we can spend a bit of time doing a deep dive on that, which hopefully will answer all the questions that you may have on this space.
Thanks.
Thank you, Jora. Thanks, Kirsty and Ian. Any other questions or comments for Chris on the performance report? Great, good. Thank you, Chris, very much indeed. So, Kirsty, it's over to you for the change portfolio update, and I think Amy's joining us for this as well.
Thanks. I'm not sure if Amy's coming, but I will crack on with this. So this is both the change update and our people update. We rolled them into one. So I'll pick up the change update first. So over the last quarter, I think we have continued to make good progress with our extensive program of change. It is a fairly large and complex beast that we're dealing with, but we are continuing to push forward. Some of the key highlights that we have now developed, we're now in the process of developing our business case to support the work to deliver on our new target operating model. And this is based on the high-level design and implementation plan that we agreed both with the executive and the board over the last few months. We've also managed to open our new London office where we have now created a shared space with partner organisations. This is a new and really modern working environment with lots of collaborative space. So as soon as we're able, we'll look forward to being able to get back into that office, which is now down in Stratford. We have mobilised a new programme to upgrade our HR and finance system. This is going to provide a modern, high-quality user experience and more efficient ways of working, and really help to move us to a much more of a sort of self-service approach around how we consume our HR and finance data, and is really going to help drive efficiencies and a better working in that space. In terms of some of the people highlights, we've also introduced the Workforce Disability Equality Standard, setting out our commitment to improving the experience of our disabled colleagues. We've refreshed our approach to talent management across the organisation, and we've introduced the Mind Workplace Wellbeing Index to promote positive mental health and identifies areas of focus to improve our approach. So just a little bit of a sort of highlight in some of the a bit more detail on some of the programmes. The Transitional Regulatory Approach is a programme which we set up directly in response to COVID to ensure that we could continue to monitor and support providers during the pandemic. What we did was we built a new platform to help us with intelligence and a new IT tool to support this approach. We've really got that embedded now in terms of our ways of working, and we've rolled that out across the business now. So we have closed that program as it's now fully fledged into the business and working really well. So that's one that's come through the process and out the other side. In terms of the target operating model work, as I said, we've now signed off our new operating model and ways of working, and we're now focused on putting the business case together for that piece of work. We're following the Treasury 5-case model in order to build that business case, and it will be a portfolio level business case at a high level with all the individual programs nested underneath that as individual programs. The other thing we've done around our target operating model work this month is commenced our sort of organisational wide conversation around our future ways of working. Those conversations have been led by Ian and supported with the executive team, and then we've cascaded those messages down through the organisation, with each layer of management being informed and given a pack that they've then been able to cascade through their teams. I think that's gone really well, and we've had some really good feedback from colleagues in terms of the way the messages have been handled and how we've managed to support the various levels of the organisation to be able to communicate effectively. Our regulatory platform, which is going to basically provide our new operating system for the organisation, has continued to make progress. I think this is going to be a key tool for us going forwards in terms of how we drive effective and efficient working practices. Over the last month, we have focused this programme mainly on building our data architecture and the foundational capabilities of the platform. So things like architecture, taxonomies, and we've also used it to support the capabilities required to support our COVID work. And the piece I talked about earlier on the transitional regulatory approach has really utilised this new technology. Over the coming months, what we want to do with this programme is really focus on embracing, taking a service design approach to really embracing our process redesign, really looking to simplify and streamline our key processes to become to use as a really modern ways of working, to be able to harness the information and make it really easy for our colleagues to use the data in an effective way. Our registration transformation program now continues. We launched our new digital register with CQC a while back. We're continuing to scale and iterate that, and we're now focusing on the next phase, which is to allow separate registered manager applications to be made through the new system. Feedback from users has been really positive so far, with people saying the system is quicker and simpler to use, and the same feedback is coming from our own internal colleagues who are now processing the information that's coming in. In terms of IDE, Mark, I don't know, do you want to talk about that, the intelligence-driven enablers piece?
Yeah, carry on.
Yes, so I've got if I come to you at the end, Kirsty, I've got just a few things to update on, if that's okay. Okay, all right. So I'll move on to people, unless anyone's got any questions then on the change piece at this point.
So just pause for a second, because there's an awful lot there, Kirsty. Brilliant, really good. Any questions from anybody? Wow. Sally. Yes, Sally.
Thanks, Peter. I was going to follow on from the point that Jora made a few minutes ago, actually, around goals. So it feels like we've done an amazing piece of work on the strategy, and we're getting very positive feedback. And we've clearly got a well-organised change programme, but it's very complex. And I think the way that we look at it at the moment is in individual business cases and then individual benefits. And I think what I'm hearing is that we are working towards a plan where we link those things together, and we think about the goals that Jora talked about from the individual programmes and how they're going to deliver. Yeah. And I just wanted to reassure people, I think there'll be more scrutiny at the Audit and Corporate Governance Committee of how that fits together and how we look at risk, because we're clearly in a very pressured situation, aren't we, as part of the health and social care sector as well. So I'm conscious of the pressure on our staff to deliver both business as usual with the huge efforts they're making, and also deliver the change programme. So Kirsty mentioned it, but I just wanted to reiterate, bringing all of that together, I think will be really helpful to think about the benefits we're going to get out at the end.
Yeah, so just to come back on that, Sally, I think when we set this programme of change up a couple of years ago, we had in effect three sort of buckets of activity. The first one was underpinning capability, so reinvesting in our in our IT and capabilities, and to bringing us up to having modern systems. We had a piece of work that was looking at improving our sort of regulatory activity today, and then a piece of work that was looking at the future. That served us quite well up till now, but now we have a new strategy. What we want to do is make sure that all the work is aligned to delivering on our strategic ambition, and we're pulling that together into the portfolio, which is a piece of work we're doing around putting that business case together, and that will look at it holistically and look at making sure that all the work that we have in train is actually clearly connected to the strategic ambitions. We can make sure that we're managing those interdependencies to ensure that we are delivering things in the right order to enable the next bit of work and the next bit of work, so it sort of builds the cumulative. But it also gives us a really good understanding of the interdependencies between the programme and that delivery risk in terms of if one bit gets delayed, what does that mean here? So absolutely, that's the piece of work that now is being done, but we couldn't do that before because we needed to have that high level strategy to make sure we've got everything anchored to that point, which is where we're coming to now.
Good. Mark, you've got your hand up, Mark Sutton. But
yeah, I think so. Perhaps if I come in on the digital update just before Kirsty moves on to onto people, then that might fit in well. It's okay. So very briefly, I think in the last quarter for digital, it's been a quarter of working on really foundational work across the key programs. So as Kirsty said, regulatory platform and the intelligence-driven enablers work, but also continuous improvement work in our technology service, and that what is actually pretty groundbreaking pioneering technology in our new shared London office in Stratford. On the regulatory platform, as Kirsty said, this is kind of core foundational work. So what we've delivered is a new data architecture that sits there, and we've synchronized this data between a new platform and our old platform. So that provides a really good grounding for us to continue to develop in our new system and have data flowing between new and old, and that will really underpin a number of streams that we are running in tandem alongside that service design approach that Kirsty talked about, that will make a significant digital transformation for our providers, our regulatory colleagues, and for the public in what is a couple of year programme. We've also, of course, continued to extend out that transitional monitoring app, which supports our current regulatory monitoring activity, and we've over the last quarter continued to extend that functionality to cover areas like infection prevention control assessments, designated settings in adult social care, and now the monitoring of vaccination centres as well. But as Kirsty said, that's now closed, and we're focused on our regulatory programme activity going forwards. The main work around intelligent-driven enablers is building a business case that's going to go through the approval process now for the full business and technology work to support our strategy to become an insight-driven organisation. But in the interim, we've been progressing a proof of concept, and we've built a foundation of Microsoft Azure-based components to collect and manage data that will provide and does provide a working analytics model that showcases how we can bring the relevant insight to our regulatory work in the next couple of months. And to the point you were making, Jorah, this is the underpinning technology that will support that future ambition and the work that Helen Lowrens is doing to build out the IDO. On the continuous technology improvement, we've successfully concluded that Digital Foundations programme, but we've now embarked upon what is continuous improvement. Our new service desk and security operations centre are settling in really well, with customer satisfaction levels on that service desk over 90%. And we're now halfway through a rollout of a new Windows 10 laptop image to further increase the stability and resilience of colleagues' technology, which has been a challenge with everyone working from home, but successful so far. And we've launched just very recently a new integration service with Microsoft Teams, which allows our colleagues to raise a new ticket or even chat to service desk colleagues all through the Teams service that people are familiar with using on a day-to-day basis. And finally, just a word on that new technologies to support the London office. What we've implemented is something which was quite challenging, because we've got not just the CQC, but we've got 4 arm's length bodies in the healthcare arena who are occupying that new office, and we've built out the technology from a bare office to support all of that, but also to support 5 organisations who are all on different levels of technology. And what we built is something that's actually pretty unique to government hubs, which is a completely secure setting that is dynamically configurable. So you could actually go to any desk, plug in with your machine, and it would dynamically recognise you as a CQC individual or one of the other arm's length body organisations, and provide you the services that are relevant for you, and just only give you access to those things that are relevant for your organisation. So it's not only fit for purpose for now, but also will support new ways of working, agile, flexible spaces, and any changes that we want to make to that setup in the future. So a good solid culture of foundational work, and now we're looking forward to moving on to the next period of delivery of really important transformational work to support our regulatory colleagues. Thanks, Peter.
Thank you, Mark. Any questions for Mark? So, Mark, can I just say, as somebody who was dreading having to get a different laptop, having actually managed to make my existing one work quite well, the new one arrived, and the whole way it's been managed, and the ease with which you move to the new one when you're not in the office, I thought was fantastic, and you might just pass that back to colleagues. Really well done.
I will pass that on. Thank you, Peter.
Right. Nobody's coming in with anything. That's excellent. Good. So, Kirsty, it's back to you, I think.
Yes, thanks. So, in terms of our people update, so I think it would be fair to say that we have a lot of activity happening across our people agenda. I think we've got a number of programs and activities which give us a sort of holistic approach to building both the skills and capabilities we need in the organisation, not just for now, but also into the future. And we have continued to make some really good progress with this over the last quarter. So some of the things that we've been doing, we're about to launch our new talent program within the organisation. And what we've been doing before the launch of that is working closely with colleagues across the organisations and our networks, so that we can really develop a new approach to talent and all the supporting materials that go alongside that. So we want to be able to use this to not only just encourage a more diverse talent pipeline and a really good succession plan through the organisation, but actually to use our talent programme to really ensure that we can help everybody develop their career whilst at CQC and tailor that to people's own personal ambitions. So that's going to be launched this month. I think it's a really good development piece, and will and hopefully I'm confident will help contribute towards our D&I agenda. We've also, over the last year, we developed a piece of work around success profiles, which is sort of setting out the key behaviours that we expect to see at every level of the organisation. This has really sort of codified that, and it's been a really, really positive piece of work. And we're now starting to put that into practice. And what we're now doing is building that into our recruitment process, which gives us a much more structured framework for our recruitment, both in terms of able to understand our candidates' ability and fit for the role, but also to give people who are applying for roles a really good idea of the sort of skills and capabilities that we're looking for on a sort of standard level. We've also, as part of that work, we've also conducted a review into our internal recruitment processes. We've had some findings there that we've now fed into the recommendations, fed those recommendations into our diversity and inclusion plan to make sure that we really are taking that learning to address some of the deficits that we have in terms of our diverse workforce, particularly at some of the senior levels in the organisation. We've had an ongoing review of our processes, of our policies, to really make sure that we bring those up to date and modernise those. We've been working on these over the last year, taking a chunk at a time, and over the last quarter, we've now reviewed 7 key policies and put those into action. That sounds like a quick statement, but there's a huge amount of work that goes involved in those process reviews, really engaging with our colleagues and unions to make sure that those policies are fair and are really fit for purpose. As I said, we've continued to focus on our D&I agenda, and this time, for the first time, we have now participated in the Workforce Disability Equality Standard, and we are also continuing to participate with the Workforce Race Equality Standard. And we are focusing on the key issues that have emerged through those processes and feeding those into our D&I strategy. As part of that work, we've also been well challenged by our newly established Action for Race Equality group, and they're there to make sure that we are ambitious in our targets around our D&I agenda, and they've been really positive and helped really ensure that we are being ambitious in what we're looking to do around this really important agenda. The other thing that we've done, which is really quite exciting, I think, is to help us improve understanding and cultural awareness at a sort of senior level in the organisation. We've implemented a reverse mentoring programme. So now every senior leader within CQC is being monitored by a black and ethnic minority or black or ethnic minority colleague. It's been a really insightful process. I have a mentor, as does everyone else on the board, and it's been a really insightful process, some fascinating conversations, and something that I think we want to really continue to support. Our wellbeing continues to be important, particularly at the moment. We've got a lot on our plate in terms of both responding to the COVID pandemic, but also ensuring that we can keep the sort of business as usual work going, and also continue to develop the organisation for our future. So we have a clear focus on our wellbeing and working with the people leads to make sure that we are addressing that in many ways. And as well as that, we are also looking to build our management capability through the development of a management pathway. And as part of that work, we'll be not just looking at sort of basic management skills and sort of things about how to have difficult conversations, but also things about building resilience and coping with stress and things like that. So as I said, overall, we have a huge amount happening across our agenda. We are tackling this holistically so that we really can continue to build and support the organisation now and in the future. We have a big programme of organisational development that we're kicking off as part of an organisational design that we're kicking off as part of our target operating model work, and really looking at the skills and capabilities that we need to build for the future and working out how we start to do that and align that with the transformation programme as well. So that's a very brief run through of some of the activities that we've been doing on the people front over the last quarter.
So I'm out of breath just listening to all of that, Kirsty. It's brilliant, excellent. Jora, you want to come in?
Yeah, just one question, Kirsty, and Mark and Ian. When you have like a transformation, when you guys have done transformations and I've done a couple, it seems like the goal is so far away. It's a bit like, well, my football team's never going to win the Premiership, but they at least may celebrate, the odd occasional win that they get. How do we make sure, as part of the engagement, that we're also celebrating the small successes, but we know we're moving towards this North Star? How do we sort of, there's in that, I'm sort of, just listening to Kirsty and Mark, I was like, wow, but how do we ensure that sort of engagement? There's so much going on in the CQC that's so good right now. And we need to make sure, but it's tricky because you don't want it just as a sort of thanks and you move on to the next project and now you're red on this and now you're amber on this and so it isn't. Is there any thought being put behind this? I don't have the answer. I'm just asking the question. I guess that's why I'm a Ned, because I don't have to have answers on this one. But I'd be interested in your insight.
Ian, do you want to start?
Yeah, thanks, Peter. My football team did win the Premier League last year, but they may not again this year. I think the serious point is, I think we've got to know. We spent a lot of time, and Kirsty touched on it earlier on. We spent a lot of time over the last 2 to 3 years on projects which were bringing us up to a level that was solving problems. So in terms of the what do we show people internally around what's different? Well, we show them the laptop they've now got on their hand. That laptop now works consistently. It now runs a full suite of digital services. It doesn't yet, give them access to advanced analytics and the sorts of things that we were talking about earlier on. That is the next phase. So I think to some extent we can talk about problems that people recognised in their day job, which we have now solved. So there's a win, I think, in there. But it's also, I think, about drawing colleagues into the programs themselves, and all of the programs have got engagement strategies that go with them, and getting them involved in conversations to say, well, this is where this is going to go in terms of your North Star point, but there are a series of steps to get there, and this is what the physical things might be in those steps. And sometimes, the conversation might go something along the lines of, well, actually, can we deliver this thing a bit earlier? So there's probably no completely clean answer to the question you're asking, but I think it is absolutely something we're aware of, and it was something that when we were running the engagement activity over the last 2 or 3 weeks around the wider transformation activity, what some of the feedback from some people was, yeah, this is all very interesting, but it doesn't look like it's going to impact on me for the next 12, 18, in some cases 24 months, and that's true in part. But I think from our point of view, we need to be thinking about how to get a series of drops of delivery that people can put their arms around and see and touch and think, actually, that is making a difference to me, even if a change in line management or whatever is a way away. So I think that's some of it, I think. But Peter, I think colleagues want to jump in and add to that as well.
Yeah, lots of them. Do you want Mark Sutton? Do you want to come in, and then Kirsty, and then Chris?
Thank you. I mean, just to echo what Ian said there, in terms of, it's absolutely our focus to get a regular drumbeat of delivery, so that we can, people can see and touch the things that are. Now, some things, of course, have got to have a finance system has got to have a start and an end, and we won't see anything till the end. But most of the things that we're working on, we're building iteratively, and we will have things to show people. So, I mean, an example of that is. On the TMA delivery, we've just introduced something which is a portfolio review, which allows people to inspectors to record the outcome of their review of data and particular monitoring activity. That's something we've introduced as part of close working with inspectors, the things that will be most useful to them in their work, and that's something that's just been introduced and gone live very recently. We also have, I think, which is helpful as part of that engagement, Jora, is regular show and tell. So we're showing the stuff that we're developing, and people can feed into that, and there'll be the opportunity for them to see the things that are just coming up and see them as they land. And I think this, the important thing is for us to think about the different stakeholders groups as well. So we will be looking across all the different aspects of our regulatory colleagues, but also providers and also the public as well, and looking at what drops we can make at various times to show and demonstrate progress as we go through this.
Thanks, Mark. Kirsty.
So thank you. So just to add a little bit more colour to some of that, Joe, I think we've set this out over the next 5 years. That's a long time as a programme, and there's a huge amount of activity. And I think to bring it to life, we talk about a target operating model, and people go, what does that mean? And we've broken it. I think we've got a number of transition states where we're going to do a bit of work, and there'll be some really clear outputs from that, and then the next bit and the next bit. And I think we've got 4 or 5 of those transition states over the next 5 years. But I think the key bit that we need to do is, at the end of that period of time, we need to be really clear to people is what it's going to look and feel like for them. How is it going to be different? Because quite a few of those early transition states might not affect that many people across the organisation. It'll certainly have a big effect on some, but not everybody. And I think the work that we're doing around building personas is enabling them to talk about, we can create people of these personas that start to talk about what it feels like for them to do their job on a day-to-day basis. But actually also really importantly, given the real sense of connection to our purpose here, what the difference those things will make to the outside world and to our how we are regulating, and the impact that will make on people who use services. So those bits are hardwired into the into the comms. We're creating those personas, because I think that's a really, really good way of bringing this to life and getting people to feel a sense of what it will actually feel like when we get there. And then hopefully when they get there, they can say, oh yes, that was right. And we can keep those journeys being updated as we progress through those transition states.
Thanks. Chris Day.
Yeah, just to build on that, I guess all of the work is focused on, for the work that Kirsty talked about in terms of personas, is focused on two things: understanding and recognising people's problems today. So that will be colleagues, it would be providers, it would be people who use services. So understanding the problems of the day and understanding the ambition of the future. The North Star for me is a strategy which sort of links those two things. So what problems are we trying to resolve today? So as Ian rightly said, 2 years ago, the problem was, do I have a laptop that works, that can work with the systems that I've got to work with? So that was the immediate pressing problem. And I guess through the regular conversations, the regular engagement with all groups, it's important to sort of understand what's the top issues at the moment, and use the programs of work to reflect how we navigate those long-term programs, but with a focus on solving problems today, but also having an ambition for the future. And it was really interesting in the conversation, the launch of the strategy and the launch of the conversation around TOO. There's a lot of ambition, not just from colleagues internally, but also from providers and people who use services for us. So it's important to harness the optimism of the ambition, but also to deal with the problems of today.
Thanks. Mark Saxton, you wanted to come in. Are you talking about this, or are you moving on to a different subject? Because if you're moving on, I'll just ask Jora if he wants to come back. But Mark.
We'll ask Jora first, and then I'll come in.
Okay, perfect. Jora, do you want to respond to any of Ian, Mark, or Kirsty or Chris?
No, I mean, that was great. I was taking notes. So I think it's right on the right lines. I think, if I may, Peter, as a sideline story, just to sort of reiterate, what was being said there is a sort of show and tell and solving the problems today. And so there was an interesting book about Amazon. I can share it at some other point, where they work backwards. The book's about backwards, and there was a chap who went to and present to Bezos, and so he'd done his MBA and he'd come out of Yale or Harvard or whatever it was, and he had his spreadsheets and competitive analysis and SWOT analysis and gap analysis and so he did this sort of hour to Bezos, and sort of Bezos looked at him and he went, "That's really good," and the chap said, "I don't think he actually meant that," but then he said, "Where's the mock-up?" And it was the mock-up that he really wanted to see, because this person was responsible for Amazon Music, and they couldn't take on Napster and all these other companies that had come in. But through that mock-up and insight from other parts of Amazon, they came up with Alexa. And they said there's something that we have to differentiate. So I think what's just been said is really cool, because it allows innovation across the organization, not just, the digital folks or the technologists or the product people, but everybody should be innovating. And I think by having these show and tells and mock-ups, it allows us to get insight from the inspectors who are sort of going, well, how will this help me? And with those personas that Kirsty talked about. So yeah, it was just a really, really good answer, and that's it from me.
Thank you, Jora. So Mark Saxton, to you.
Thanks. Yeah, no, I enjoyed that debate as well. That was good. I want to make a separate point to Kirsty to say that I think it's great that you bring this report to this board. What to me it tells me is that there's actually the ability to do business as usual and to transform, but you're doing it around the model. The model is the people plan. That's what we invested in. I think you can really see the outputs coming through each element of the people plan. So I really support it. I think it's a great part of the reporting process that you do. So thank you.
Thanks.
Great. Ian, sorry, you want to come back, Ian?
Sorry, just a quick one on the back of what Mark's just said. I think that I just want to make the point that we want to, as Mark said, do business as usual, do transformation. And by the way, what COVID has also taught us is an ability to move through the gears up and down in the event that something else changes. Because I think we've there's a danger that we think of COVID-19 as having a beginning, a middle, and an end, and we're coming towards the end of it. And there's a real question that says, is there another business disruption thing, which might be to do with COVID or the pandemic? It might be an extreme weather event, it might be climate change, it might be whatever it is. But I think over the next 5 to 10 years, we need to be thinking about the ability to do business as usual, but the ability to change our scope and the nature of our business really on the fly, which adds an additional level of complexity to the whole idea of what business as usual really means. And I think all of our thinking is starting to move in that direction as well now. So it's an extra, it's a third component to that business as usual plus transformation piece that I think we need to have at the back of our mind. Sadly, but I think it's a reality of today.
It certainly is. So one of the problems of not being in the room is that I can't always catch people's eyes. Latoya, can I just check that you don't want to come in? There's no pressure for you to come in, but if you did want to say anything before we move on, please do.
I don't have anything to add.
Okay, perfect. Very good. In which case, let's move on. And Chris, I think it's with you on the Insight report.
Yes. This is the 8th Insight report that we've done through the COVID crisis. So I thought I'd just we've done some evaluation over the last few weeks. I just thought I'd give colleagues just a sort of a reminder of why we do this and a little bit about the feedback we've had so far. So during the time of COVID, it was really important that we could be clear about what we were seeing in a more timely way than some of our thematic reports would allow. So we wanted to have a regular drumbeat of the things that we were seeing to help guide decision makers both nationally and locally to take the right actions during the pandemic. So it was very important to me that we were able to do this in real time to provide a clear picture on the key themes, offering clarity against some of the assumptions and the anecdotes that might be there, and to try and speak on behalf of the whole system, not just health or social care. So that we have a good understanding of the things both internally and externally ourselves, but also we can support that wider conversation. Just in terms of some of the feedback we've had, we've been testing this with both providers and other stakeholders. First of all, in terms of awareness, really strong awareness of the product's existence, which is a useful way to make sure it's going to be used. About 84% in adult social care, 77% in hospitals, and about 55% in primary medical services. Obviously, there's work to do on each of those, but it's a good start. But crucially for me, the ability to take action on the back of what the report was said, particularly from national stakeholders, but also from local providers, was important as well. It prompted conversations at local level between providers and local authorities, health and wellbeing boards, and it also gave organisations like Health Watch and other organisations the ability to ask other pertinent questions. So just to give you a sense of how the fact we'll continue this evaluation over a period of time to look at how we can provide the information in a more useful way for people. Particularly what we found is that the consistent data that we've provided at the back end of this report really does guide people who might want to use the data. So not just academics, but also local system partners to take the right action locally. So I just wanted to give a sort of a sense of how the reports are being used. This report, Report 8, takes a closer look at how urgent and emergency care services in secondary care and community care have been affected by the pandemic during the winter. And it highlights the action taken by CQC to support organisations that are under pressure. The challenges in emergency services arising from an increase in demand are not new. In fact, even before, at the very start of the pandemic, in April 2020, we were working with frontline clinicians from emergency departments to look at how ED, particularly in secondary care, could support and mitigate risk, and what they could do to manage services better in their area. This led to the publication of a thing called Patient First, which was a document, as I said, that we wrote alongside clinicians to give a real sense of how secondary care can support the better management of patients through the secondary care pathway. It looked at a number of issues around flow, around infection control, around reducing patients' need to be in emergency departments, staffing across ED, and also the treatment within emergency departments. What the data in this report has shown is that there are still some challenges that some organisations are facing in managing the flow of people, and particularly those admitted in to hospital in a timely way. And it demonstrates some of the variation that we found when we first produced the patient first principles. There are some things really interesting. It's actually been a case that the normal demand on A&E in terms of the attendances are proportionately down this winter compared to last winter, but the 4-hour target has still not been met. Some of the anecdotes around this and some of the conversations we've been having is around that the capacity of other parts of the hospital is still causing that backup into A&E, which is still causing some of that variation. This report also shows some of the variation in different parts of the country. Urgent and emergency care is not just about acute A&E departments. It also covers primary care, community-based care, and all services contribute to how people receive an emergency response. As Rosie said earlier, we're shortly going to publish our urgent and emergency care provider collaborative review, which shows some of the interesting insight about how different parts of the country have managed during the COVID crisis. What's clear to me, and probably clear to others, is where there are good pre-existing relationships, the COVID pandemic acted as a catalyst for collaboration between primary and secondary care, and it often relied upon those partnerships and that understanding. But where that was in place, then governance and funding and a setting of common goals was much easier. And agreeing how we can support this moving forward as we move out of our pandemic, I think will be key. Peter, I'm happy to take some questions or comments on the report and any of the data in it.
Great, Chris. Thank you. Great report as always. It's a really good series. I'm very pleased that you're doing this. Ted, you wanted to come in.
Yes, I'd just second that, Peter. I think this is excellent, and a big thank you to the team that put this report together. I think it's the best insights I've seen into what's going on in urgent emergency care over this winter, and it is a very interesting picture. I've heard people saying that they were taken aback by the impact of COVID on urgent emergency care during the winter, which I think is strange, because in truth we've been warning about this since, as Chris said, April, and the College of Emergency Medicine has been worried about it as well. It's clear that COVID is going to have an impact, but actually this analysis that in the Insight report I think is a very interesting a reflection on the impact it has, and it is very mixed. There's a reduction in attendances at A&E, but an increase in delays with A&E departments, reflecting the mixture of pressures they're facing. I think more than anything, what this is showing, and we are inspecting emergency departments at the moment, and we're producing reports. There have been reports published today, and there'll be more reports published over the next few weeks, which we'll bring together into lessons learned in due course. But I think the overarching message is that emergency departments have responded as well as they can within their capacity to the enormous pressures of COVID, and I have to say we've seen some excellent work going on. But the underlying issues of capacity in our urgent emergency care system, which we pointed out in previous winters, are still there, and they've been brought to the fore by the COVID pandemic. And really, going forward into future winters, these issues need to be addressed if we're not going to have more difficult winters coming in the years ahead.
Thank you, Ted. Robert.
Thank you. A really great report, and please keep them coming. They're really good. My question is about capacity and the comment you did make, which Chris, which is actually normal figures for A&E have not gone up. And as I understand it, and I'm happy to be corrected if it's wrong, there hasn't been a spike in relation to flu. In fact, flu, which has always been the previous winter problem, is in effect non-existent. And I'd be fascinated to know why that might be the case. But secondly, is there something to be learnt then about putting it bluntly, flu cases, make sure they're treated in some different way other than A&E? Or is it just that people aren't, all flu cases are now thought being diagnosed as COVID? I mean, there's something clearly very fundamental here that it strikes me that the system perhaps needs to learn from.
I'll try and put my PhD hat on. So I've been talking to colleagues in PhD about this. I'm sure others have as well. So PhD, now they do regular testing of the population around flu. So it's not just about people being misdiagnosed as COVID or flu. But you're absolutely right. There's been a tremendous drop-off in flu cases. PH, you believe it's a result of the social distancing and the wearing of masks and the washing hands measures that came with COVID. So, in a sense, a knock-on impact of the rules, if you like, around COVID has meant that flu has almost. I think the last case was sometime in December, and there's literally been 1 or 2 cases over that time. So there's very, very few outbreaks of what might be described as normal flu. There's also been an increase in the uptake of the flu vaccine, which may also have supported it. But you're absolutely right. But your wider point then about where you don't see those indicators, the fact that the hospitals are still struggling is an important one. And the relationship between, as we've said and Ted said on many occasions, the relationship between a hospital and other elements of its local network are really important if you're going to manage flow effectively. It is not just about what happens inside the walls of a hospital, and we've already paid tribute to the people who work in those settings under tremendous pressure. But the relationship between those and other parts of the system in an area, I think there's some of the differences between how different parts of the system are responding to the pressures of COVID in an acute setting.
Thank you.
Good. Jora.
Just a quick question, Chris. I was looking, great report. I was looking at page 13. Does the definition of flow and the relationships in the network, as you just described, does the definition of well-led then change? Because currently, I guess well-led is inside of your own network or inside of your own. But does our definition then change if you're looking at it more holistically?
Well, we've said. I mean, Ted may want to come in here as well, but we've been looking at what well-led means in all settings and all sectors. But certainly, we think over the last 3 years since we began the early work on looking at systems as a whole, the importance of leaders not just managing within their own environment, but being a partner to a local system is a key feature of how well-led should be defined. So there are already key lines of inquiry around this area, but I think it's this crisis has shown that where you have those relationships and where leaders can act together well, where they can share resources, have a common vision, and have common metrics for what good looks like, you will get people who use services will get a better outcome. So certainly it's an important feature of well-led, and I think one that we are increasingly going to focus on in our work going ahead. Ted wants to come in as well, I think.
So does Rose. But Ted, you go first. Go on.
Well, just to second that, really, I think we need to understand leadership in terms of system leadership when it comes to urgent and emergency care. It cannot just be done within one part of the system. You can have excellent leadership within the emergency department, but if the hospital leadership doesn't support them and the system doesn't support the hospital, then they can still run into capacity problems. And I think the capacity mismatch we see within emergency care is sometimes physical capacity, sometimes it's ability for patients to flow through the system. The fact we see that mismatch is a reflection of the fact that system leadership has not really grasped the issues. And I think there's a real challenge going forward that we should look at well-led from a system perspective wherever we can.
Thank you. Rosie, did you want to add?
Just to add to that as well, because as people know, most of urgent and emergency care actually happens outside of the hospital, and it's so important that the system, all parts of the system, are involved in what is often quite a complicated kind of set of pathways: primary care, community pharmacies, dentists, adult social care. All of those parts of the system need to be taking ownership of this and working together. And I think we've got a real opportunity as we work with our system-wide approaches. We're learning through the provider collaboration reviews and the previous work we've done on the local system reviews, as we start to look at what the ICS developments will bring with the white paper. I think there's a real opportunity for us to test this, because as Ted said, that leadership at every part of the system is really important at a very kind of small primary care network level, right the way up to the ICS level, and we need to make sure that all parts of the community are very involved in those discussions.
Thanks, Rosie. Sally.
Thanks, everybody. I agree about the points around our well-led domain and the importance of system leadership. But I'm just wondering whether what's happened with COVID is actually a fundamental shift in the way that people use healthcare, and it's more about public behaviour. So lots of people are, we've been trying for years across health to try and reduce the number of A&E attendances, and as Rosie said, spread the care, the urgent and emergency care around the system so that people are treated in the right place when they need it. And it might be that, in the same way that apparently lots of hand washing has reduced the incidence of flu and also bacterial infections. If the public continue to behave in a more health conscious way in terms of infection prevention, but they also change their behaviour, they don't go to the GP as often, they're happy with remote and phone conversations, they don't go to A&E as often because they seek help elsewhere, then that requires us, doesn't it, as CQC, to regulate in a different way, but also to make sure that we're still encouraging the public to come forward for treatment when they need it, because some of these excess deaths that we have seen are about people being afraid of COVID and not coming forward for a different reason. So I think there's a really interesting piece of work and something we could tap into around public behaviour, as well as the way that we look at leadership of the system.
I absolutely agree, Sally. We've been doing some work with NHS England and Public Health England and sort of the nudge unit leading this piece of work on what out of this crisis do we want to promote in terms of a different way to offer public health. And in our context, I think it's important that people can still feel they can access the services that will help them, but they don't have to access the services that they used to do. So people used to, there was a lot of work done a while ago to say, why do people go to A&E? Well, it's a branded service that people understand and people know about, and they think they will get better. But actually, what the crisis has shown us, there are other ways in which you can get the care that you need. And I think you're right. There's a really important message that I think is led by Public Health England, but working alongside ourselves, NHS England, and others to make sure people understand what is available to them, how we can use potentially technology in a different way, but still to make sure that people access the services they need at the time they need them, because that's the key. The issue as we come out of COVID into recovery, how do we make sure that access to care is managed well in different areas that responds to the local health needs of our population? And I think the challenge for us as an organisation is how do we support that work? How do we show what's working well in different areas? And how do we add our weight to the changes that we want to see that happen at that regional level?
Great. So Rosie, then Ted, and then Latoya. Rosie.
I just agreeing with Sally. I think those are really important points, and I think we need to encourage local providers and integrated care systems to be ensuring that people have the right information to be able to make the right choices, and really empower people to decide on what's on where they go for their treatment or whether they can self-manage. And I think a lot of the people who haven't attended general practice or A&E departments actually have had self-limiting conditions that have got better by themselves. However, I think I would really like to just reiterate that message that it's really important for the public, if you have symptoms you're worried about, to go and seek help. I think we're all concerned about the number of people that haven't got the help that they need, either felt worried about going in and accessing that help or not being able to access the care and treatment they need. So I think we just need to reiterate that message that if people are worried about their symptoms, to go and get the help they need. But I think the other thing, our role is absolutely making sure that people, if they do need help, they are able to access the care that they need, as Chris has said.
Yeah, Ted.
Just to reiterate what Rosie was saying there, services have worked very hard to keep other urgent emergency care available for people who've got non-COVID conditions. And so people should, if they've got symptoms that they're concerned about, that they think are serious illness, they should be seeking help. And I think there is a worry that some people may not have been seeking the help they should have been over the past. I think the fundamental issue is that we need urgent emergency care to be designed around the way people need it to be provided for them. The reason why people go to A&E are mixed, but a lot of it is just because it's open 24 hours a day and it's a walk-in service and it's easy to get to. So we need to make sure that services are available in the way that people want to use them, rather than expecting people to adapt to the models of care that have been around for many, many years.
Yeah. Latoya.
Hi. So just in agreement with Ted about the way people use services. And I think this point is important for healthcare workers, but then just any kind of worker in the UK. It's just about education and like sickness policies. So, you know, people are afraid to miss work because of having the common cold that could then extend to something else. And part of our look at health inequalities should be sickness policies and how that affects people, you know, being afraid to miss a day of work and missing an important chunk of their earnings for the month because, you know, they have a cold and they just can't do that. And then like GP appointments are unavailable after 7, or if they work unsociable hours, it can be really difficult to access kind of healthcare services that you need. And so there's been a mentality before COVID of just powering through and coming to work with the cold, and then obviously causing other people to get sick as well. So I think it's important to note that people earning under a certain amount of money as an annual income won't have the luxury of always thinking about maybe like their health in a daily sense, but then will rush to A&E when they physically and emotionally like cannot breathe or something like that, and, you know, kind of visibly need the help that only A&E, I guess, in that situation can provide.
Thanks, Latoya. Good, really good points. Thank you. Stephen has just joined us, so Stephen, welcome to the meeting. Any other points from anybody? So what I'm going to suggest is, because we're running just miraculously a few minutes ahead of time, and we've got various colleagues joining us for the next 2 items. So Sally, could we just take the Acgc report to give the other colleagues a chance to get to us?
Of course.
Thank you.
Thank you. So there was an AGC meeting on the 3rd of February. It had a whole new cast of characters, including me as the new chair and a number of my non-exec colleagues. We have produced a summary report in the minutes. It's important just to note a couple of things. The point I made before about the laying of our annual report and accounts isn't and hasn't been a CQC issue. It is around the local government pension scheme, but I'm very pleased that we have been able to lay that report. And I'd like to say thank you to all of the people in CQC who've contributed. I know Chris Usher's here on the call today, and we did say thanks in the Acgc meeting, but I think I'd like that recorded because it was a huge effort to put that together. It does have an implication for the same timetable this year, because the National Audit Office have alerted us to the fact that the same timetable and the same delays are likely. And we, along with other organisations that I've been involved with, have challenged them on the timetable. It's auditors seeking reassurance from auditors, particularly when most of those pension schemes are funded. But we will report back on the timetable. I think just expect more of the same this year. The other point is around internal audit and risk. So I'm quite keen to, as I mentioned before, make that link between our new strategy, the programmes we have, and the risks we face in delivery as an organisation. And we started that process during the February meeting. We had a number of reports from our internal audit providers. And there is a tender process going on to think about who should take that internal audit contract forward. The Transformation Subcommittee, which looked at most of our change programme in a little bit more depth than Acgc can normally do, is still operating, and I've been to one of those meetings. Mark Saxton and Jura and myself are going to operate that on a rolling chair basis to see who's relevant in terms of inputting their expertise and who's relevant to chair. But I'd like to say thanks to Mark for chairing a really good subcommittee meeting that we had a week or two ago. So more of the same. I like to think we're being dynamic and we're supporting both the new strategy and the whole portfolio of change programmes that we have, and look forward to seeing people in the meeting at the end of March. Thank you.
Thank you, Sally. Any questions for Sally? Sally, can I just say, I wholeheartedly agree that the idea that it becomes routine that our financial statements are published 11 months after the year end. It's really completely unacceptable. So outside our control, but anything we and other organisations can do to put some pressure on, they should do, because certainly the hold-ups are not at our end at all. Great. Good. So everybody's now here. I'm not sure they weren't here before, but anyway, they're all here now. So we'll get back to the order of the agenda. So the next item is the Action for Race Equality group. And Kirsty, I don't know whether you're going to just introduce this. Sue Howard, I know, is with us, and you're extremely welcome, Sue.
Thank you.
No, I'm not. This is their show, so I'm going to let them get on with it. So, Sue, over to you.
Okay. Sue.
Good afternoon, everybody. I'm going to introduce Taufik to you, who is he's a chair of the Race Equality Network, but he's also a keen member of the Action for Race Equality group, and he's going to present this paper to you. So over to Taufik. Thank you.
And Taufik, you attended our board not long ago, so most of us know you very well. Anyway, over to you. You may be on mute, or...
Thank you very much. A very good afternoon to you all. I'm heavily supported today by a colleague of mine, Omar Phillips. Omar, do you want to introduce yourself, please? Thank you.
I'm not sure he joined us, Taufik.
Oh, okay.
I'm sorry.
Oh, I'm so sorry. Let me just go back again. So, very good afternoon. My name is Taufik Balogun. Co-chair member of the Race Equality Network and member of the Action for Race Equality Network. I would like today to present to the board the Race Action Plan, which the board will endorse for publication along with the next step for the group. The Race Action Plan has been mapped against all 9 race indicators, and we would particularly like to thank Organization Development for doing this very important work for us. We would also like to draw your attention to the 3 aim statements. These were developed as a result of a commissioned quality improvement piece of work, which involved a review of data, existing policies, and extensive engagement across CQC, which includes the Race Equality Network, which I'm co-chair of, together with Latoya. We would like these 3 aim statements, please see slide 3, to be the priority of the Action for Race Equality group in 2021-2022. Although, naturally, we support all of the important work to promote race equality within CQC. We are pleased to tell you that a dedicated project manager has now been recruited to support the Action for Race Equality group with this work. We would also like you to support our next steps, which list below. Further development and implementation of the Acgc engagement plan. The Race Action Plan will be a live plan which will be added to, amended, and expedited as required. This Race Action Plan does not preclude Acgc, CQC, and the OD from suggesting immediate and/or additional action where and when required. We will develop an agreed way of working across all interested parties, the Race Equality Network, the OD, the Acgc, with approved, understood roles and responsibilities. Thank you so much, and we welcome any question.
Thank you, Taufik. Really good report. Does anybody want to come in at that point? Ian.
Thanks, Peter. I just wanted to extend my thanks to Taufik and Sue and a number of other colleagues who've worked very hard on this. I think that the really important point here is those 3 aim statements are designed to be 3 big statements of principle. There's a tangibility to them, which is good, they are supported very much by the race equality scheme, which has a series of smaller actions and smaller targets within it. I think if all of those things come together, it is helpful. But I think one of the great things about the work that Sue and colleagues and Taufik are doing is just this recognition that this is a multifactorial challenge that we all face. It's not a challenge that we as CQC alone can solve, but I think we are definitely making strides in the right direction. And I think there's also a sense within the organisation that in having this conversation in this open and straightforward way that we have been doing, that we're actually able to influence providers and making sure that our inspectors, as they go out and do their jobs, are able to influence well beyond, if you like, the walls of CQC. So, a big thank you for the work that's gone on, but also recognising this is not a short-term thing, but it's something that I think everybody is incredibly committed to, and I've been really pleased at the level of the groundswell of opinion from everyone in CQC for this agenda. And every time I have Taufik and other colleagues on my weekly calls and so forth, there's a real positivity around this agenda, which I think is really good. It's more than just this action plan, good as it is. There's a positivity in the organisation around this agenda. Thanks, Peter.
Great, thanks, Ian. Stephen.
Thank you, Peter, and many apologies for joining so late, but I'm very pleased that I have joined just in time to very much welcome this paper and all of the great work it clearly represents. And as a new board member, this is very much me kind of not understanding quite yet sort of the culture of the organisation and how you all work. But I was struck by the third of the key priorities. Zero tolerance for discrimination, with a year-on-year reduction in the proportion of BAME colleagues reporting they've personally experienced discrimination. I've had lots of discussions in lots of organisations over the years around that's great, that's fine. It does rather depend on the degree of confidence that those working in the organisation have in the reporting systems. And for some organisations, there's kind of a prior issue that colleagues may feel, do you know what, I have concerns, I've had experiences that I don't think are acceptable, but I don't honestly believe that if I report them through these formal systems, then nothing much is going to happen. So I'm interested in sort of where you feel CQC is in that sense of sort of general internal confidence amongst colleagues that I can report, I should report, it will be taken seriously, someone will follow it up, in which case, if everyone's already there, you could expect to see over time a decline in reporting. If it's not where you are, the first actually important step is to increase the level of reporting, because that may be a measure of confidence in the reporting system in the first place. Does that make sense? So just sort of question.
Yeah, it makes lots of sense. Sue, do you want to have a go?
Yeah, I can certainly respond to that. I mean, you're absolutely right, Stephen, in that, to be honest, in the first instance, we're hoping to see an increase in that if we get this right. The whole point of this group is that it is a very much a collective, collaborative group from right across CQC that includes organisational development, includes Race Equality Network colleagues, but we also are tapping into every opportunity to encourage people to speak up. So we're also working, for example, with our Speak Up Guardians and tapping into to the facility, to the opportunities that we have there. One of the key things we're going to be doing is putting together an engagement strategy for this group. And we're going to make sure that the work that we're doing really becomes everyday language, becomes the business of everybody, becomes something that people talk about as the most normal thing in the world. And to be honest, we're going to be a little bit in people's faces with this. We're going to be regularly in Ian's calls. We're going to have an intranet page. We're going to make sure that we're really getting the message across loud and clear that this is a cultural shift. We expect to see people being encouraged and promote, to speak up and to be honest about the experiences that they're having. And one of the great things is that we want to really build the relationships with colleagues from a black and minority ethnic background, so that they really start to trust us. They really know that they can come forward, that they're protected, that they're safe, that this is a safe environment. So you're right. We expect there might be an increase in the beginning, but we really want to set all of the. And there's some fantastic work already going on, so please don't think there isn't already, but we want to work with others to really encourage that.
Thanks, Sue. Lots of hands have gone up, but Jill, do you want to come in, Jill Nicholson, just probably responding on that last point, I expect?
Thanks, Peter. So, Stephen, nice to meet you. I think we've got our introductory chat in next week or so. I think it's a really important point you make. We have data from our regular people surveys which indicate the difference between a perception of bullying and harassment or discrimination, and then the reporting of any incidents. So yes, we've got clear data which indicates that there is a gap that we would need to continue to address. I think the wider cultural piece is really interesting, and I'm happy to pick that up sort of separately when we talk. I think for me, and others will have heard me say this before, sort of this goes to the heart of relationships in organisations. It goes to the heart of the confidence and skill and capability of line managers to be able to listen effectively and be alert to issues, and therefore then there is a clear relationship and trust that that somebody will be supported, but also that actually people are aware of microaggressions and call people out on behaviour. And I think, we've got a lot to do in order to, like very many organisations, this is not unique to CQC, to really focus on that key relationship of line management.
Thanks. Mark Chambers.
Thank you. And I'm raising another sort of general line management point in relation to this. I mean, I would commend this report, and I commend this action plan. It's wonderful to see this level of commitment and to see the huge amount of effort that has gone into producing such a comprehensive plan. This really will change the dial if we can deliver this, and we've all got to be behind this plan. The one area where there was only one point which I wanted to call out, which I thought was perhaps a bit narrowly presented in the plan, and it's the one on feedback after interviews on page 4 of the report, and the recommendation that positive and meaningful feedback is given to all candidates. Yes, absolutely, interviews are a really important milestone and an opportunity to look at the whole person. And a great opportunity to give rounded feedback for people. But, way too many times I've found over the years, line managers are just too polite and too nice and hold back and don't give the difficult feedback that is essential for people to make progression. So, so yes, absolutely, people should be given honest, constructive, candid, and above all, actionable feedback following interviews, and they should be given the support to follow up on that. But I think we've got to make sure that is ingrained in all interactions by managers, with managers, so that people all the time are given the support that they need to address things which might be holding them back in their advancement. So my encouragement would be to make sure that this is drawn more widely, and there is the active support for managers to have those rounded conversations and candid conversations on a day-to-day basis. But I would thoroughly endorse this plan. I think it's great to see.
Thank you, Mark. Good point. Ali and then Robert. Ali.
Thank you. Just to echo what colleagues have said, really excellent report and really important that we are focusing on what's such an important area. I wanted to specifically highlight and applaud really the fact that you have clarified the 3 key ambitions in such a direct, clear manner. And I think that's going to be a real strength in making sure that we focus on outcomes as we continue. Thank you.
Thank you.
Thanks, Sally. And then Robert.
Thank you. My praise, along with everyone else's. Question really along the lines of Stephen had about the last point, about the second point in relation to recruitment, career development, and so on. There's a stage before anyone applies for a job or a post or a training or whatever, which is having the confidence and the encouragement to do that. And some people's life experience, rather as it does in the harassment space, suggests to them, wrongly, one would hope in this organisation, that if they put themselves forward, they won't get anywhere. And I wonder what is intended to be done in that space in relation to the responsibility that line managers have to encourage people to think of themselves differently in terms of, they can do things and put themselves forward. And the extent to which the culture of our organisation is one which just expects that to happen as to one where it assumes that it happens.
So, Jill, do you want to say anything in response?
I'm happy to come in on that. Thank you. So, Robert, I think it's a really good point that you make. We're doing a lot of stuff that should guide our line managers to have the right kind of career conversations with their colleagues. We've refreshed and just about to launch our new talent strategy. So, and that goes throughout the organisation, so encouraging career conversations. So actually, I'd expect by managing through a process that we will not only identify those who've got potential to progress and be able to then support them to develop and deploy them and mobilise them effectively across the organisation, because that's a key part of development for me, but also that we've got an opportunity then to sort of spot where we might have some cold spots. So really have some data that helps us understand where the right quality of conversations are not actually happening in the organisation. So I think that in itself as a tool will help us. The work that we're doing through the People Plan online management capability has at the heart of it this sort of the key points that have been made. Mark made them really, Chambers made them around feedback. It is vitally important, and actually we've got anecdotal and clear, also qualitative evidence that not everybody gets feedback in sort of set piece recruitment activity. So I think we have got a way to go to encourage people to have open and honest conversations and not see them as difficult and something they should shy away from.
Thanks.
Sally,
Sally,
I wholly agree with that.
Sorry, Robert, didn't mean to cut across you. Sally, and then I'm going to go back to Tafik and then we're going to move on. So Sally.
Yeah, just a quick point to say I endorse the report and applaud the aims as well. I think the proof of the pudding, as always, is in the eating, isn't it? So we have a fantastic plan. I think as a board, it's up to us and through the Race Equality Action Group to monitor improvements in the statistics we have. And I think I'm right in saying that CQC is one of the larger health arm's length bodies that has, certainly RES, I'm not sure about disability, monitored on a number of actions, and we get fed back. So we would be able to see the progress that other health arm's length bodies are making as well. And we should play a full part in that, not only on race, but on disability, which I know is the next topic that we're going to move on to.
Thank you, Sally. Tafik, do you want to say anything by way of conclusion? You're on mute, my friend.
Oh, my apologies. Sorry, Peter. Thanks, Peter. The statistics clearly show that we're still lagging behind. And we know this matters will take time to clear up, to resolve. And I believe we're on the right track, which obviously starts with the acceptance of this paper. And once this has been approved, I believe there is nothing further hindering us from delivering what I believe is a societal problem, which I've already pasted in the chat. I think we can be proud of us going forward. Thank you very much.
Thank you, and thank you for all the work that you and colleagues are doing on this. I think I can safely interpret from the positive comments that have been said around the board table that we do endorse this report for publication, but I just confirm that. Excellent. So we formally endorse the publication, and we will obviously be watching with great interest how successful we are in progressing things. So let us move on as to the next item, which is the Workforce Disability Equality Standard Annual Report. I know my friend Paul Kirby has joined us. I'm not sure who's introducing this. Mark Sutton, are you doing anything by way of introduction? Perfect.
Very brief introduction. So as you said, we've got Paul Kirby here, who's the chair of our Disability Equality Network, joining us, and also Kieran Prashar, who I will hand over to shortly, who can provide some more detail about the report. But in very brief summary, this is the first time that we're adopting this standard. So this is the NHS standard called the Workforce Disability Equality Standard, and it's really important that to help us understand and improve the experience of disabled colleagues. As part of the introduction of this standard, we've measured ourselves against those empirical metrics that are required, and that's really helped us identify the areas for improvement for us. And we're starting to we're standing up a project to help us develop those that action plan over a period of time in a very similar way that we talked about in the last item. So I'll just hand over to Kieran then for a little bit more detail.
Thanks very much, Mark, and hello everybody. So as Mark said, we've got this is the first time that we are pulling together. We've kind of submitted our data for the Workforce Disability Equality Standard, and I just wanted to say kind of upfront really that this action plan has been jointly developed with our colleagues from the Disability Equality Network, and it's a real product of partnership really. So a big thank you to Paul and his colleagues from the Disability Equality Network for working with us on that. And as Mark has said, the plan will be kind of overseen through a project group led by Mark, and all of the activities that are within the action plan are aligned to our diversity and inclusion strategy. So we can see the thread running through all of this. So some highlights really from the action plan just to draw out, as there is lots of detail in there. So we're looking to improve representation of disabled colleagues across the organisation, but particularly at senior levels, and that is a theme that runs across the WES and the WDES. And we're doing that through our recruitment approaches and ensuring that they are as inclusive as possible, and where we can kind of look to introduce new ways of doing things to improve that, we will do. We're also looking at increasing the number of disabled colleagues who are taking part in coaching and mentoring as part of their career development, as part of kind of improving that representation. Another key action for us is reviewing our reasonable adjustments policy and process to really understand what lies behind the inconsistent experiences that colleagues are reporting around having reasonable adjustments in place to enable them to do their job well, and looking at how we can improve that. So that's a really key part of the action plan. Another one is working really closely with Paul and colleagues in the Disability Equality Network on understanding the issues that are lying behind colleagues reporting higher instances of experiences of bullying, harassment and discrimination, whether that be from the public or whether that be internally. And again, there's a link here across between the RES and the WDES around using a respect campaign to really start to promote the behaviours that we expect within the organisation, and zero tolerance around those behaviours that we don't want to see. And finally, there is also a continued focus on improving our data and increasing the self-reporting rates for disability, which we know kind of vary across different parts of the organisation, and doing that through regular campaigns is another really important part of the plan. So you'll see that there are some links across, as obviously both the RES and the WDES are strongly linked to our diversity and inclusion plan. So hopefully you can see how all of these activities all do align. But I'm happy to take any comments or questions.
Thanks, Kieran. That's really good. Anybody want to come in at this point? Mark Chambers.
Thanks. Thanks very much for this. And yet again, it's it's I don't echo what I said on the previous item. It's great to see the focus on this, and it's great to see a spirited approach to it actually being translated through to a concrete action plan. I mean, things are not going to happen without a plan, and that's great to see. I had a question in relation to, because this is the first year that we've submitted this, so I'm hoping that we're going to get some benchmarking information in response to this, and it would be interesting to see that at some stage. I mean, again, context to that, benchmarking I think would be useful in some areas where we probably don't know what level we should be at. So things like barriers to self-reporting of disability status, we're probably going to never get to zero, and it would be good to understand where we think we should be. But on all the other metrics, even though our goal doesn't change, our goal is absolute performance. Relative performance is quite helpful in terms of understanding relative performance is helpful in terms of prioritization, and it's helpful to understand where you're behind your peers and you can seek out best practices, or where you're ahead and you should be encouraging others. So I'm right, I think that we're going to see some benchmarking information, and how are you intending to use that? It would be useful to hear that.
Jill, can you hang on to that, because I know Stephen and then Sally want to come in, and then maybe they'll all ask questions that you need to answer. But Stephen, first of all.
Great, thank you, Peter. And again, thank you ever so much, colleagues, for a really important piece of work here. The area I just wanted to understand a bit better is how you see this relating to what I guess is a wider programme relating to mental health. Because we're all seeing in all of our organisations, I guess, significant and really quite worrying trends in relation to mental health. How does that sit in relation to a sort of formal policy around disability in the workplace?
Thanks. And then Sally, and then we'll come to Jill.
Yeah, thank you. I applaud the report again. I wanted to say I think there are some fairly quick wins, such as, only around half of people think that we make relevant adjustments to them in the workplace. And I think there are some harder wins around declaration, for example, or helping people understand more what might be a hidden disability. And I don't know whether you have any senior people in the organisation who are happy to talk about something they have. I think I've just enhanced your board disability. I have a hidden condition. I'm very happy to talk about it. I never used to regard myself as disabled in any way, shape or form, and I still don't. It doesn't affect my ability to do my job. But I think the declaration and the support that we offer to people is quite important. And on that, I think one of the performance reports we had earlier showed that we have, I think it's around 12% in the relevant population who declare as disabled. CQC's is around 7%, but there's an undeclared gap of around 7%. And there's a big question, isn't there, over whether we're actually representative of the normal population, and that's fine, we should still proceed with our plan, but whether we're actually not because of the undeclared bit. So I think there are some easy things to do and some harder things to do. I'm happy to help out with the harder things if that's relevant.
So, Jill, I'm going to keep putting you on hold because there are lots of things for you to come back on. But Paul Kirby, you have your hand up, I think.
Yes, I did, and I'm trying to put my hands down to make sure it's not an old hand that I keep getting told. Just to reiterate some of the comments, good afternoon, board members. Some of the faces I've not met before, so it's good to see some new faces. I just wanted to reiterate, in the DEN group, we have so many, I've decided to have so many subgroups. When we talk about, Stephen, talk about mental health, we've got a mental health subgroup. And if you appreciate the disability disability is quite a range from, somebody mentioned about the hidden disability, right up to visual and hearing impairment, so on. So we've got 8 subgroups in the Den that have specifically targeted certain areas. For example, we've got the Dragon users groups that focus on the technology issues, and before I was actually filtered all those issues I couldn't deal with. So that's why we have the subgroup mental health, physical, we've got sensory and so on. So anything the commission say that can you look at this policy or look at the changes, or even just moving Office of Stratford, any barriers and everything else, I can allocate those to certain subgroups. But this report is the benchmark of the start of that step. So hopefully where the next journey will be is hopefully spread out with other areas. And I appreciate, Steve, mental health is a big, vast area that it's more now than ever during COVID, and they're self-isolating and so on. So this is a good start of the bench, sort of a springboard of the doing that report, and hopefully from the work onwards, working with the OD team, that we have more focus. But what really would help with hopefully the next pulse survey with a lot of D&I strategy in there that will benchmark closely what we've been doing and what's changing. So it's hopeful, and it's nice to be involved in the positive changes.
Thank you, Paul, and we're grateful for your involvement. Jill, do you want just to respond to anything that hasn't been responded to?
Respond to a couple of those things. So I actually was going to bring Paul in and to answer your particular question, Stephen, because I know that he has got his subgroups, including mental health. I would just add to that we are, as an organisation, offering a huge amount of support to people who might be struggling at the moment because of the ongoing pandemic, or simply because they are having a particularly difficult time anyway. So I think we obviously have still got to pay really close attention to this, but I'm confident that Paul's subgroup are alerting any issues that we might have in the organisation and bringing them to me and the OD team to share. They work really closely with our wellbeing reps as well. So that's sort of, I hope, covers off your important question. Mark's point about benchmarking, yes, absolutely, can't wait to get our hands on the data. I think, as you articulated, and as well in terms of the RES data, which is more established and we've been publishing against for longer, and getting access to sort of that benchmarking across wider organisations, there are some things that we will be stronger at, and some things where we'll be wanting to learn from those who are in a better place than us and have learnt some lessons already. So I think that applies to both to the race equality work and also to the disability equality work. So I'm really keen to continue to look at that benchmarking. And Sally, you're absolutely right. Some of this is potentially harder to shift than it is. And I think on the reasonable adjustments and the data that we've got there, I mean, Paul and I and our wider teams have had lots of conversations about this previously with Mark Sutton as the sponsor. I think it does bear, although you've described it as a quick win, I think it does bear some further work and understanding, because I think what sits behind that is probably some local interventions and activities that may be lacking that we're not actually yet aware of. So I think there is probably a sense that Paul, through his network and of colleagues, can help us get to understand more what it is that is impacting the percentage of people who are saying they're not getting the adjustments that they need, because I don't necessarily think that is entirely technical or equipment adjustments or contractual changes that we would manage centrally. So there's more to understand, but I think we should get to a point sooner rather than later where we can address that particularly meaningfully. And then your second point about hidden disabilities, but also the influence and of senior role models in this is really, really important. I was having a conversation a few months ago with some senior colleagues, one of whom said, I have a long-term health condition. I'd never considered it a disability. I don't tick a disability box, but I'm really happy to share my story. And I think the power of storytelling is really important. It encourages people to feel as if they are able to share something personal. So I'm really happy to have a conversation offline, Sally, about how you could be part of that storytelling. It'd be really great to get sort of some board involvement. So thank you.
Thank you, Jill. And I think from the conversation that we've just had, I'm pretty confident that the board's happy to endorse the publication of the report. Everybody's nodding, so again, thank you very much, everybody, for bringing it, and Paul, thank you for all the work that you're doing with your colleagues, much appreciated. So I think we're just left with any other business, if there is any other business. Good. No other business from the board. We do have two questions from a member of the public, Robin Pike. The first is, how does CQC monitor referrals from GPs to hospital trusts? There's some examples given, but I won't read those out. But Ted, that's probably one for you to answer, please.
Thank you, Peter. So as part of our inspections of hospital trusts, we do assess how they manage referrals and waiting lists, and we look at that under the responsive key question. So the responsive key question focuses very much on this, and this is particularly a feature when we're looking at elective services and outpatient services. And I think Robin is right to raise this, because this is an area we've found problems in the past, and we have found poor practice in the past about managing referrals and waiting lists. But we've reported on this quite extensively and taken enforcement action where necessary. And I think practice has improved considerably over the last few years. But this is an area we will continue to keep a focus on going forward. And of course, this is going to be really important in the provider management of the backlog of care that I talked about earlier on. Their effective management of waiting lists and referrals is going to be absolutely central to make sure that people do get the right prioritisation and the right care at the right time. Robin mentioned CCGs and their role. Of course, we don't regulate CCGs, but his reference to them is an important reminder of the importance of how patients experience care within systems, and how it's really important the system builds care around the needs of individual patients. And that is very much a feature of our strategy going forward.
Thank you, Ted. And then the second question from Robin is, how can CQC improve access to its website? A Google search for CQC currently shows 2 commercial organisations selling inspection advice above the actual CQC site. Chris Day.
Yeah, so Robin quite rightly mentions that having a good website that can engage people, providers and other groups is really, really important. It is our biggest channel for engaging all groups. What Robin refers to is paid for advertising, where paid for advertisers have an ability to jump rankings. As we've been talking, I've just sort of looked at a number of searches. So if you search for CQC, you will see one pay for advert above us, but you'll see on the right hand side our name, our organisation and who we are, as well as obviously the details of us. If you search care home rating, we're top. If you search hospital rating, we're top. If you search GP rating, we're top. So it really does, some people do choose to buy advertising. I think it's important that we have a good website with good HTML content that will naturally form part of the come to the top without the need for advertising. So we are the first service that appears after advertising. I think it's more important to have a good website with good engaging content and good links that will push us to the top of those Google ratings, rather than continually pay for advertising. It'd say today it's one, but you can still see, even on the CQC where there is one organisation there, you can still see us in detail on the right hand side.
Great, thank you very much, Chris. I hope that answers your questions, Robin. And with that, we can end our public board meeting. Thank you all very much indeed. And we are supposed to be back at 2:15. But we are running behind because we didn't manage to do the change portfolio update. So I wonder, is half an hour long enough for lunch and start again?